Leadership and Organizational Systems. Presented by Kara Bells for South College, 5110 Foundational Concepts and Application. Nursing leadership is a social and relational process of positive influence and engaged decision making linked to actions and attitudes that benefit nursing, patients, and the healthcare environment. Transformational leadership motivates followers by appealing to higher ideas and moral values, where the leader has a deep set of internal values and ideas and empowers others to act. In today's healthcare, nurse practitioners are in a unique position to provide transition of care from care homes to the next provider. Future nurse practitioners will need to possess leadership skills in order to lead the interprofessional team in providing safe, quality care. Nurse practitioners will need to be aware of their own belief system and their own strengths and weaknesses to be effective nurse leaders. In addition, nurse practitioners will need to place emphasis on mentoring other members of the profession and interprofessional team. Effective mentoring requires nurse practitioners to place the team's success above their own. The lack of communication between tertiary care providers has left increased likelihood of patient harm. It will be through leadership supporting teamwork and communication that will transform healthcare organizations into high reliability organizations that are consistently providing safe care and quality outcomes. Organizational systems. Systems are used to identify situations or factors that could cause human error and change the underlying systems of care in order to reduce the occurrence of errors or minimize their impact. Systems seek to develop processes to deliver both quality and safety. Organizational systems are the basis for how care is delivered in the healthcare setting. The purpose of systems is to provide instruction and education to staff members so that consistent outcomes of care are achieved. Initially, systems were used in industrial organizations. However, healthcare realized that having processes for staff members to follow provided consistency that was lacking when trying to decrease patient harm. Systems are also a way to provide competencies to staff, understanding how failure occurs and how important the systems are in creating safe care. Organizational systems provide a framework for consistent quality care that reduces likelihood of harm. Systems seek to have overlap in care to close the gaps in human error that can occur. James Reason's Swiss cheese model of medical errors explains the holes that can occur in systems that create errors. Organization systems development must be transparent and include interprofessional team members. With education and training, systems become a technique to achieve high reliability outcomes. High reliability outcomes translate into greater patient safety and quality of care. Safety and quality are the basis for how healthcare organizations are judged by consumers, providers, and insurance companies. Reimbursement is ultimately tied to safety and quality. Swiss cheese model recognizes that there are many layers to systems, both engineered and people. Systems have holes that can momentarily line up, causing errors or patient harm. Unlike actual Swiss cheese, the model has holes that are constantly changing. When the holes line up, errors occur. The model has two areas of failure: active failures that are unsafe acts performed by people, and latent failures that are decisions made by leadership that have the potential for causing harm. For instance, time pressure, understaffing, inadequate equipment, fatigue, and inexperience. Active failures have short lived impact on the integrity of the system. Latent failures have a long term impact but can be identified and reversed before an unsafe event occurs. This promotes proactive risk management. Organizational systems include the interprofessional team, recognize systems can be flawed, recognize people are flawed, and must be continually assessed and reassessed. Interprofessional team, as we have learned, is imperative to positive outcomes in the delivery of care. Communication with the team needs to be open and accepting of everyone's contribution. Team members include other disciplines such as physical therapy, occupational therapy, speech therapy, social services, activities, dietary, the medical doctor, nurse practitioner, and of course, the patient and family members. The organizational systems approach recognizes that both systems and people are flawed. The systems approach emphasizes that human error is inevitable, especially in systems as complex as healthcare. The systems seek to address the underlying causes of human error, to change the system and mitigate the error. Because of this, systems must be continually assessed and reassessed to improve quality assurance. Clinical nurse leaders. As clinical nurse leaders, nurse practitioners are in a prime position to facilitate the use of organizational systems and also improve organizational systems. Using systems creates higher reliability and increases patient safety. With the emphasis on transition of care services, nurse practitioners will be able to feel the need of leading the patient through the healthcare system, provide education to the patient and family, communicate with the interprofessional team, and provide a reference point for the MD, family, and interprofessional team. As healthcare organizations change, nurse practitioners will be in a position to fill current unknown areas of leadership that will require master's level training. Advanced practice nurse leaders. The QSIN competencies are closely related to how systems are developed, and I want to review those quickly. Evidence-based practice, patient-centered care, teamwork and collaboration, quality improvement, informatics, and safety. QSIN competencies translate to areas of systems development. Looking at the QSIN competencies, they are closely related to how systems are developed, implemented, and maintained. Evidence-based practice, communication, teamwork, leadership, quality improvement, and patient safety are all involved in systems development. With the push for more clinical leaders, nurse practitioners will need to possess and practice the QSIN competencies to provide safer patient outcomes and quality of care. Organizational systems for clinical nurse leaders. As nurse practitioners, the organizational systems will be the processes used to provide safe patient care. Mentoring will need nurse practitioners to be consistent with their practice. The person being mentored will need to see the systems in place and being used. For this reason, nurse practitioners must be vigilant and follow the organizational systems that are in place, but also keep an open mind when being asked about processes in the systems. Examples: medication reconciliation, discharge process, SBAR, and safety huddle. Medication reconciliation is a system of checking patient medication for duplicate orders, correct dosages, interactions with other medications, and patient allergies. The discharge process is important for patient safety and to decrease the likelihood of rehospitalization. The discharge process looks at all aspects of a patient's living situation, such as home environment, availability of assistance, and equipment needed, taking this information with the medical progress to determine barriers to discharge and how to best address those barriers for successful discharge. A proper discharge system includes all members of the interdisciplinary team. SBAR is a tool used to prompt effective communication between providers. It asks for situation, background, assessment, and recommendations. This tool is used to provide better communication for safer decision making related to patient care. There are SBARs for specific diseases. For example, urinary tract infection, gastrointestinal tract infection, upper respiratory infection, neurological symptoms, and musculoskeletal issues. Safety huddles are performed several times a day. The interprofessional team gathers to discuss patient progress and safety concerns. The team then discusses solutions to the issues and any barriers to the solutions. Using the team approach enables input from all caregivers to provide a more complete picture of what is needed and inclusion of all aspects of patient care. Organizational systems use systems as a way to minimize human failure in providing patient care. Effective systems create better culture of patient safety. Systems are used to educate and train employees in processes that mitigate or eliminate the likelihood of human failure. There must be a process for evaluating and implementing these systems. Although it would be easier to put a system in place and walk away, there must be a process to evaluate a system for effectiveness. Assessing systems. There are 3 systems that you can use to assess a system. There's failure mode effective analysis, root cause analysis, and comprehensive unit-based safety program. Failure mode effective analysis is proactive to find failures before they occur, evaluates each step in a system to find areas that could cause injury or harm, and develops processes to mitigate injuries. Failure mode effective analysis has several steps that begin with identifying systems in your organization that have the possibility of failing, then using a step-by-step breakdown of the system to determine where the failure might occur. Once that is done, team members are assigned a specific task and asked to develop an intervention to prevent the failure. Once the intervention is in place, it is evaluated to determine the effectiveness. If the intervention is not effective, then the team members will design a new intervention and evaluate to determine its effectiveness. This process continues until an appropriate intervention is developed. One weakness is the process depends on people and their understanding of the system. Root cause analysis. Reactive to an incident that has already occurred, identifies the problem, asks why to find the ultimate cause of the occurrence. Root cause analysis is also known as the 5 whys process. Root cause analysis asks why something occurred and drills down to the basic reason the incident occurred. The team uses this process to develop interventions and determine their effectiveness. This is also known as the fishbone method. Comprehensive Unit-Based Safety Program, or CUSP. Created by clinicians, uses evidence-based practices, includes team members, and must have leadership support. Unlike the other two processes, CUSP was developed by clinicians to decrease the time it takes to implement evidence-based practices and processes. It seeks leadership support and teamwork to provide the basis for systems that are proven to be placed into practice. Differences. Each of the aforementioned systems has strengths and weaknesses. Failure mode effective analysis is a lengthy process. It has 10 steps. Root cause analysis is a reactive process that happens after an incident has occurred. And CUSP is a quicker process that seeks to implement evidence-based practice quickly and efficiently. Each of the processes depend on people. Leadership must take an active role in support for the implementing and sustaining the system changes. With evidence-based practice taking up to 20 years to implement in healthcare organizations, the CUSP method is a quicker implementation system. CUSP has been used to enhance care transitions and the discharge process. Leadership. Clinical leadership must support the organizational systems in place, but also guide the interprofessional team to improve systems when needed. Systems must work within the organization and provide high reliability. As clinical leaders, nurse practitioners will need to support use of evidence-based practice systems, quality improvement of systems, and education and mentoring for future leaders. Future leadership must be educated and possess competencies in organizational systems and leadership in order to sustain the quality improvement process for healthcare systems. Healthcare providers must always be working towards high reliability. Leaders supporting systems. The clinical leader's willingness to support an organizational system has a direct relationship on whether the system will be successful. As clinical leaders, nurse practitioners' attitudes towards the systems will be imperative to the success of a system. Nurse practitioners must portray unwavering reinforcement by following the systems that are in place and support sustaining the systems through quality improvement and education. Placing emphasis on practicing what is expected will enable nurse practitioners to be the clinical leaders healthcare organizations are currently missing. In conclusion, leadership engagement in patient safety and quality initiatives is imperative. 75% to 80% of all initiatives that require people to change their behaviors fail in the absence of leadership managing the change. Leadership must improve leader competencies and skills across all levels of the organization for systems to be effectively carried out and sustained. As clinical leaders, nurse practitioners' support and mentoring for future leaders will be instrumental in maintaining the systems and their effectiveness. Clinical leaders are in an ever-changing world of healthcare and must be able to adapt and support new evidence-based practice systems, educate quickly, and ensure better outcomes. Leadership communication and teamwork will prove to be the basis for an ever changing healthcare world, a world where leadership and organizational systems lead to high reliability.